All right, everybody, it is Dr. K. Kenton from the Black Hills Regional Eye Institute. Now we've got a small pupil case that I found, probably did it within the last month or so. Making an incision, and we're using BSS with omidria in it straight from the machine. And the omidria does a really good job of keeping the pupil dilated or dilating the pupil, so we'll get that in there. And then a little bit of lidocaine, and then use visco to dilate and try a little bit of viscodilation. You want to get it big enough at this point to get an adequate size capsulorhexis. I mean, you can go back out, or you can go out under the capsule with your Utrata forceps, but the bigger the pupil, the easier it is. We'll make our main incision. We want a longer incision in case there's any tendency for the pupil to come to the wound. So this doesn't really look like a floppy iris, it's just a poorly dilating iris, and there is a difference, of course, but you never really know until you get the flow in there. Now we're going to make our capsulorhexis as big or bigger than the pupil. It's hard to get out too far under the pupil for whatever reason. The capsulorhexis just doesn't get very much bigger than the pupil unless you put the forceps out under the pupil, and then you can get a larger one. So we'll bring this around, again, trying to get things as large as possible from a sizing standpoint. There we go. And then we'll do our hydrodissection and hydrodelineation. Remember, when you're doing hydrodissection with a small pupil, don't do so much that the pupil wants to exit the wound. So you do have to be careful. Watch for that fluid wave and be done. Push down, get rid of the fluid, do the same thing on the other side. Get out under the iris and under the capsulorhexis edge. They're kind of at the same spot, remember, so if you go deep enough, you will definitely be out kind of under both of them. And then we're going to rotate and do our hydrodelineation. I think hydrodelineation is an important step when the pupil is small because it allows you to get that central nuclear material out. Another technique might be to prolapse the lens interiorly, but I tend not to do that. Now we'll get a little more viscode in, and then we'll get our phaco tip, clear out the central visco to allow for good flow, and clear out that central cortical and epinuclear material. There we go. And you can notice the pupil is not really moving very much. Now we'll sculpt, and you know you can't get too far out into the periphery, or you might not be comfortable. So just go deep. That's going to be your key. Get deep sculpt, and then you want to get that first crack. Once you get the first crack, as you know, with all cases, it becomes that much easier. We already know we've got good rotation, and we can see to the bottom there's a good crack there. So we'll rotate, and we'll chop out under the capsule into that epinuclear and cortical material. You can put your second instrument right into that. And we'll take out each piece one at a time. Notice my second instrument is just anterior to the phaco tip, preventing the iris from coming to the tip. You would be surprised how far across the eye the iris can shoot if it's being drawn to the tip. Again, in this case, it's not a very floppy iris, but nevertheless, you do want to be careful or mindful of that. Now we've almost got all the nuclear material out. There is going to be some epinucleus. There we go. And that usually comes out pretty easily. Obviously, taking out epinuclear material is an extra step that a lot of surgeons don't appreciate doing, but I don't mind it. It's just kind of become routine. It does take probably an extra 20 seconds. So we'll get that out of there, and then we'll just go do our IA. Becomes like a routine case now. All right, so Now we use the IA. I do often use the IA to get out some epinuclear material if I don't want to put the phaco probe, all the way into the angle. And you can just go around gently pulling off pieces of the cortex. Occasionally you might find that it's difficult in these small pupil cases to get the subincisional cortex. So what I do in those situations is use a second instrument to hold back the pupil while I use the IA probe in the other hand and get the subincisional cortex. If you have it by manual, you could do that. Otherwise, I often kind of power wash the capsule and spray BSS subincisionally, and that tends to release that subincisional cortex remarkably well, actually. Next, got our probisc. We want to make sure you fill the capsular bag, even though it's hard to see the edges of it. You want to make sure that you're not going to inadvertently put the lens in the sulcus. And also, be careful that the iris doesn't want to come to the, okay, and there it is. So the iris comes right into the mouth of the injector, and then you can see this lens is coming out with the leading haptic straight out, and it gets incarcerated into the pupil. So you just have to be careful. Inject slowly, and don't let it get incarcerated, and then bend that haptic the way you want it. And then I'll usually use a second instrument, or Sinskey hook rather, to position the trailing haptic. And then you can check with either second instrument or the Sinskey hook where exactly the lens is. You want to make sure the lens is in the capsule 360 degrees. So we'll go behind the lens gently, get out any viscoelastic that's back there. See that little piece of lens material? Good, we'll get that. And then we'll go around the angle and make sure that there is no viscoelastic remaining in the angle. Perfect, that is excellent. And it looks like the lens is in the bag. Sometimes I do check. If I'm really not sure, I'll check the edges for the edges of the capsule. It doesn't look like I'm going to do that here. And we will hydrate our incisions. And that's it. Sometimes as you hydrate, you can expand that pupil. You can see the edge of the capsule as well. So sometimes that helps. We will get in some moxie. And let's see now, what are we doing? Just kind of washing behind the capsule and rotating to get the haptics where I want them. Let's see if we can rotate that lens a little bit. I'm just going to leave it. All right. Folks, have a great day.